Good afternoon, everyone. We are so excited to have in our office today Ashley Hunnicutt. She's the executive director for Loudoun Free Clinic, who I met Ashley at the business breakfast at the Loudoun Chamber of Commerce, and I was so excited and so impressed of what they do. So we're gonna learn today all the great things about Loudoun Free Clinic. Ashley, thank you very much first for being here.
Thank you for having me.
We want to hear a little bit bio about you. Your history
okay.
a little bit, and how did you get, I know that you have a long term with Inova Hospital, but we would love to hear, before then, how did you get to all where you are right now?
Okay, in the late 90s, early 2000s, I was working for Loudoun Medical Group in Leesburg, Virginia, and that's a large group of physicians, primary care specialists, and we were asked to be on a committee that was starting the Loudoun Free Clinic. Dr. Chris Chiantella, who's the chief medical officer at Inova Loudoun Hospital now, actually started it, and a group of physicians, community leaders, healthcare administrators. That's what I am. I'm a healthcare administrator. We opened it up, and we first were only open for a few hours in the evenings in the health department in downtown Leesburg. So we saw patients there that way, and then as the years went on, I was on the board. I was a volunteer board member actually in the very beginning. So that went on for probably 10 years, and then as I left Loudoun Medical Group, I went to work for Inova Healthcare, and I came off the board, but I've always kept in touch with the free clinic, because it's when you start something up with a group of people, it's part of you, and you wear it on your sleeve. It's important. So that's how I first became involved with the free clinic, was as a volunteer board member. So as you were saying, I went to work for Inova for several years, and when I did that, I moved from Leesburg over into Vienna, Virginia, and I came off of Loudoun Free Clinic's board probably in 2011, after serving for over 10 years on the board as a chair at large. So I had started a consulting company 3 or 4 years ago, and the Loudoun Free Clinic's executive director left in late 2022 after COVID, and I got a call in the beginning of 23 that they needed some help. So I was able to help them since January of 23 on a part-time basis as the interim executive director, and just a few weeks ago, after some long discussions, the board asked me to stay on full-time, so I accepted the position, just started full-time last week.
Oh, congratulations!
So thank you. No, it's a full circle, and it's very gratifying. I'm lucky. I'm fortunate to have such a great board and great staff and wonderful volunteer positions and just a great community uplift. So it's really a treat for me. Actually, it's all mine. Pleasure's all mine.
Yes, and especially also you did serve on the board, so you know the organization.
Yes,
already.
absolutely.
That's a plus.
It's made a big difference. It's no learning curve. I understand what's going on there and the history of the whole organization, and that's a wonderful. That's been a big help to me.
Yeah. So Ashley, talk to us about Loudoun Free Clinic. What it is about, how the process, who are allowed to go to visit, and all that.
The Loudoun Free Clinic is a not-for-profit organization, and we treat, if you think about a primary care physician office, we are a primary care physician office with 2 full-time providers, 2 full-time nurse practitioners right now, and we have nurses on staff and administrative on staff. So if you've ever been to a doctor's office, that's exactly how we function on a day-to-day basis. But our patients are only from Loudoun County. You have to be a Loudoun County resident. You have to be an adult over the age of 19. We only see adults, no children. And you have to be in a certain income level. You can't make over 300% of the federal poverty level, which is a guideline that's confusing for some people, and they can Google it, look it up. But you have to have a certain income level, and you only uninsured people. We do not accept Medicaid. And if you come to us and apply to be a patient with us, and we find that you're eligible for Medicaid, then we get you over to a person that will help you enroll in Medicaid insurance, which is a state-sponsored insurance program. So we help people with that. But uninsured, over the age of 19, Loudoun resident. Those are the main things to become a patient at the Loudoun Free Clinic. And if you all were to come visit, you would think it just works like a doctor's office. You have a waiting room, you get called in, you go into the exam room, you get your vitals taken, your height and your weight, everything else. But we provide those services 100% free. Your prescriptions are also free. All of your imaging services, meaning if you have to get an x-ray or an ultrasound or an MRI or something, if you're having problems, Fairfax Radiology donates all of those 100% free for all of our patients.
Wow,
and the blood work is also free. That's donated by Quest Laboratories. All lab work is done 100% free. The value of those services, both Fairfax Radiology and Quest, are close to $2 million per year worth of services. So all of those services are free, and we have specialists that come and volunteer their time. We have endocrinology, we have cardiology, we have orthopedics, we have an ear, nose, and throat doctor, we have a GYN that comes twice a month and does all type of colposcopies, endometrial biopsies. She does all of those services. They come and work free several hours per month in the clinic. Then we're so fortunate in Loudoun County to have all the physicians in the Loudoun Medical Group and other private practices, and also Inova, Loudoun Hospital and Inova Health System have employed physician specialists that see our patients free as well. We send over referrals to them, and they accept our patients, and they see the patients for free in their offices. So sometimes the patients, just like the rest of us, go from our primary care office over to an appointment with the specialist, and we help coordinate those appointments for people, for our patients. So we work like a doctor's office. But
and are you open 7 days a week?
No.
Okay.
We are open 8 to 5 on Mondays and Tuesdays, and from 8 a.m. to 8 p.m. on Wednesdays and Thursdays, because a lot of people our patient population in particular, need those appointments after 5 p.m. because we all have to work, we have jobs, and everybody's working. Yeah, most of our patients are employed. Over 90% of our patients are employed. So they're might be going through a hard time. They don't have insurance for one reason or another, or don't make enough money to buy insurance sometimes. Even when your employer offers insurance, a lot of people don't realize that even when an employer can offer health insurance, sometimes that per paycheck deduction, when they split it with you, is too high for a family of 4 to afford. And their paycheck, if it was a $500 deduction every week or every other week, it might mean that they don't have enough money to pay for their housing or their groceries or other things.
So you would take in consideration also the household expense?
It is not expenses. We look at household income. The way we qualify patients is total household income.
Yeah.
That's what we look at. We don't look at their expenses really.
Yeah.
It's just if there's two in the household working with income, we look at that, and you look at how many people are living in the house. If you have a family of 4 and with only one income, then that's expensive in Loudoun County. You know, we all know how expensive the housing is. I think we talk about that maybe next week. But yeah. So that's how we qualify our patients, regardless of immigration status as well. So a lot of our patients don't speak English, so we have interpreters, and we have most of our staff is bilingual. Not me, but most of our staff is bilingual with Spanish. So that's a big help too.
Important.
Yeah.
What about hospital? If somebody came and they need a hospital?
Yes. If they need surgery, a lot of people have to have surgeries of some sort. So they might have a consultation with the surgeon at the surgeon's office, and then we make sure that visit is coordinated and taken care of, and they don't get charged for that. And then we work with University of Virginia, UVA, some all the way in Charlottesville, but the majority of our patients go to Inova Loudoun Hospital for their services. So some outpatient surgery centers are also helping us with surgeons. There's a Stone Springs Surgery Center. They do orthopedics if someone needs something, joints, if you will, elbows, shoulders, knees, ankles, things like that. So we have that surgery center as well, and another surgery center attached to Loudoun Hospital. So it's really up to the surgeon that any surgeon that's willing to donate their surgery, they tell us where to have the surgery. So Yeah.
So it will be
So we're very
also
lucky.
from the surgeon donated.
Right. Oh yeah, the surgeon fees are donated, the anesthesiology fees are donated, the operating room time, that's donated, all of it is 100% free. So we are very, very fortunate to have so many generous providers in Loudoun County. It's not like that. There are 68 free clinics in the state, in the Commonwealth of Virginia, and I will tell you, we are one of the most fortunate with our relationships in the community with our providers and hospitals. So we're very fortunate.
Great.
Yeah.
So tell us a little bit about, do you have any kind of programs during the year, or you are based only services?
We really just services. We manage a lot of people with diabetes and high blood pressure and high cholesterol. So we do have programs that are inside, but they're inside the clinic.
Yeah.
And we go to events for outreach. We have events that we go to, but they're not necessarily medical programs, if you will.
Yeah.
But we attend, we were just at the Tree of Life event this past 2 weeks ago in Percival, at the Unity Cup at the Loudoun County Police Department. Also, a couple weeks ago, we were there doing patient outreach. We're trying to reach out to more patients. We are growing our patient population by about, it goes up every year from the statistics that I'm pulling. Last month in July, we enrolled 51 new patients, which is the record for Loudoun Free Clinic, to have 51 new patients in 1 month. So it is, we're growing. We are growing and we're accepting new patients. So it's important that people who need the services know that they're available to them. It's really important.
Do you accept funding? I'm sure you do, but where do you get normally?
Oh, our budget.
Budget.
Sure. We have, our budget is $1.2 million per year. And we have, the state gives money to the Virginia Association of Free and Charitable Clinics, and that's where the 68 free clinics and charitable clinics, they belong to that association, and the association spreads that money out, and so it's based on patient volumes and all kinds of different things that go on in Richmond with legislation. So I think, and it helps with our prescription money as well. And I think in 2024 we will have received right around $200,000 from them per year. The County of Loudoun also helps, and they, I think this year we are receiving $160,000 from Loudoun County, because we see the residents of Loudoun County, of course. And then the Claude Moore Foundation has been very generous with us in the past and continues to be every year. Absolutely.
A lot of them.
Oh, they're wonderful. And Inova not Inova Loudoun Hospital, but the Inova Health System also gives cash benefit in the free space that we sit in, which is a huge overhead expense. As you know, rent is expensive. So we're very fortunate to have a lovely doctor's office provided at no charge by Inova.
And the 100 Women Strong.
And 100 Women Strong is a wonderful, wonderful organization, and they've given us grants 2 years in a row to help fund our community health worker who sits down with any patient who needs to apply for financial assistance at these various hospitals or surgery centers and helps fill out all of the forms. You can imagine how many forms and all kinds of information that they need to qualify for services that aren't just within our four walls of the clinic. So that's been the 100 Women Strong has been a big supporter of ours.
So Ashley, are you planning at some point to expand?
Right now we have a very large space. It's 5,000 square feet, and we have 8 exam rooms. So we're not looking to expand right now. If we could pull it off, we might. In sometime in this fiscal year, we similar to the county and the state, we work from July through June. So sometime in fiscal year 24, we might look at opening up a part-time, maybe in the evenings or something, maybe on a Friday, I'm not sure, in Sterling, Virginia. So our patients come from all over the county. That 40% of them are in Leesburg, 40% live in Sterling, 13% live in Ashburn, and the rest are all over, alphabet soup, if you will. They're all over the county. So that's maybe we might, but right now we're not at capacity. we have plenty of room, and that's why I said we're accepting new patients, and we're constantly doing patient outreach programs and events to try to just get more community awareness built up.
Yes,
so people know about these services that are available.
And that's why
to
you
them.
are here.
Yes, thank
My
you.
goal
Yes,
is
ma'am.
awareness and to know about you guys, what you do. Also, I know that you do serve adult. Any maybe opportunity for young kids in the future to open another
maybe.
door for that?
Maybe right now there are good services available. Most children in the state of Virginia are eligible for Medicaid, so they are covered. Even if the adults, their parents may not be, the children are usually covered. So there are lots of places that already take care of the children. So. But it might be. I mean, never say never. My gosh, never say never. That's right. Never say never. I like growth. I like growth. But right now, we work in conjunction with HealthWorks, which is a community health center. They have federal funding, but they take insurance, like commercial insurance, like we may have, and they also take Medicaid and they take Medicare. So they see children, and also InnovaCare's clinics for families, InnovaCare's clinic for family right here in Sterling, Virginia. They also see children and adults. They see the full age spectrum, where we focus on internal medicine and adult care right now.
So, Ashley, what about volunteer? So I know that every nonprofit organization love volunteer.
Oh, yeah.
Probably on your, I would say probably the high demand as doctors, right, or nurses.
Well, yes, both. Yeah, absolutely. We before COVID, there were roughly 70 volunteers that worked at the free clinic, maybe a day a week or maybe even once a month, administrative, clinical, all types of different. But unfortunately, during COVID and after COVID, we are a lot of people stopped volunteering, obviously during COVID.
Yeah.
We never shut the clinic down. We just did a lot of virtual, I wasn't there then obviously, but they did a lot of virtual visits, and then they reopened pretty quickly. But they lost a good core of volunteers. The whole board are volunteers, of course, and the two nurse practitioners are paid staff, but our volunteer physicians inside the clinic did drop a little. Most of them stayed, but we lost a lot of administrative volunteers, which the medical interpretation, you don't have to be a nurse or a medical assistant to do that, but understanding medical terminology is a little different than conversational terminology. So in Spanish, we've lost a lot of medical volunteers that do medical interpretation. And we also have administrative interpretation needs for volunteers, helping people fill out forms. They don't necessarily need to understand all the medical terminology, but they do need to be able to help somebody fill out all of the forms. And often the forms come in the native language of the patient, but unfortunately, the majority of our patients do not know how to read and write in their own native language. So that's an obstacle, and it's also a barrier. They feel like it is a barrier, the patients do, but when they come and they realize someone at our office will sit down with them and speak their language and help them with all the forms, they are so relieved and they're so grateful. The patients there are so grateful. But volunteers, my gosh, we need people to attend events like the ones we were just talking about recently, where we go out to a soccer field or maybe to a tournament or maybe to a county event or out to the Leesburg Flower Show. We need people to represent us, learn about the clinic, represent us, help us raise community awareness. And that's not necessarily inside the clinic, but that is something that is we always need volunteers. Because I think we lost probably 50 volunteers during COVID, and they have not come back. So we're always looking for volunteers. Yeah.
Great stuff. Any goal or what is your vision next 3 years from now for Loudoun Free?
I want, my goal in the next 3 years is to double the number of patients that we serve. Right now, our practice has 1,200 patients in it, and I'd like it to get to 2,400. And that's lofty. That is a lofty goal, but I know the data is out there that people are going without health care, and it is important that people get quality health care, because all of our patients are, my new slogan is Loudoun Free Clinic takes care of the people who take care of us. All of our patients are in the service industry. 21% of them are in food service. So just remember that when you're at a restaurant, be it fast food or fine dining, that might be one of our patients, right? 21% are in food service, and the rest are in all kinds of different service industries: cleaning, houses and offices, truck drivers, Uber drivers, delivery drivers. I mean, it is the dry cleaners. I can go on. Daycare, childcare, and elder care providers. Lots. That's another 16%. Landscaping and construction to get combined is another 18%. So it's all the service industry. So the people who take care of us, that's who we need to take care of and give it back to them and take care of them right here in our Loudoun County. That's what we have to do, right?
Absolutely.
Right. A lot of people.
Oh my God, Ashley, thank you very much.
Thank you for having me. You're so nice. You do this is lovely in your office.
Thank you for everything you do.
Oh, sure.
We are going to share the website
Right.
and also how, if any volunteer right now, would like to participate and be part of
you can go to loudonfreeclinic.org. The information to volunteer or get involved or donate. We can always use funds to help pay for everybody. That's helping everybody else there. So all of our website is up and running. We also have a big event coming on September the 8th.
Talk about that.
Sunday, September 8th is the annual Beer, Boots, and Barbecue event that I think the clinic now has been having it for close to 15 years. So it's going to be at Riverside on the Potomac, out on Sphinx Ferry Road in Leesburg, not far from, it's right on the river, and they generously donated their venue the second year in a row. They did it last year too. So we'll have live music with Melissa Quinn Fox and her band. They've donated it as well. We're serving Monk's Barbecue, something like that. We have beer from local breweries and wine from local wineries that have also given those in donations as well. So it should be, we're gonna have live music, live line dancing lessons. I've never done that, so that's gonna be new for me. Have you ever done a line dancing lesson? Oh my gosh, we gotta see, that's gonna be fun. That's probably worth the ticket itself. So it's all on our website, so please go and check it out. If there's anyone you all ever know that needs help, you can just put them right to the website. If they can't read and write and they don't understand the website, they can just call us. Our phone number's on the website as well.
They can come in. That's
Absolutely.
always help them.
Yeah, they can apply right
help
there
them
in the
fill out.
office. Absolutely. So, yeah.
Thank you very much, Ashley.
No, thank you,
We
Natasha. I appreciate it. Thank you. Thanks.